be affecting very specific groups: gay men, hemophiliacs, IV drug users, and patients. The frightening implications.
Si fijan, ese es como, en términos de contexto, es la primera. O sea, ¿a quién le da? A los homosexuales, a los hemofílicos y a los haitianos, es decir, a los negros, ¿no? O sea, ya hay como desde la entrada, desde el inicio, ¿no? Hay una estigmatización social a la enfermedad.
Disease was apparently transmitted through the blood, but how? The specter of a widening epidemic touched off a frantic hunt for whatever it was that shut down its victims' immune systems, leaving those infected both defenseless and hopeless. And yet, as you're about to see, even with the devastation mounting, efforts to find and control the mysterious killer may have been blocked. What about the scientists? Did their academic rivalries help or hinder progress? And the blood bankers, did their behavior jeopardize the public's interest while protecting their own? And the potential victims, did they refuse for too long to acknowledge the killer that was among them? As the tragic drama continued, AIDS patients suffered and struggled to come to terms with the disease.
I can recall I marched down Market Street here in San Francisco handing out condoms, being astounded at how many people were taking the condoms, but in jest, and blowing them up and popping them, having a wonderful time, and not taking the message serious.
In 1983, the message was clear. Over 300 people had mysteriously died.
There was no question that we're talking about a major epidemic. What was remarkable was that when you got this disease, it looked like everybody died, and we never had a disease like that.
The only thing the scientists knew was that AIDS was caused by something in the blood, a deadly infectious agent.
January 4th, 1983, blood suppliers from all over the country came to address the problem. One CDC expert pounded the table and pleaded, how many people have to die before something is done? It was an emotionally charged meeting.
Then the expert added, if you do nothing, it will be negligent homicide. But the blood banks didn't agree.
There were people who said we should do something, and there were others who said, what? We have no idea what to do.
The answer, when it came, was worse than anyone had imagined.
Entonces, fíjense, en términos de contexto, fíjense como desde un inicio va apareciendo el político, el económico,
el científico,
el social, ¿no? Sí, incluso, bueno, por supuesto todo está envuelto en el científico y luego esta perspectiva, ¿no? Del estigma hacia la enfermedad, ¿no? Entonces, por si no fuera suficiente con el problema científico por sí mismo, pues está todo esto que nutre esta complejísima discusión.
Kampala, Uganda, an East African country with a population of over 17 million. In 1982, the Ministry of Health's Dr. Sam Okware received a plea for help from the chief medical officer of a remote region. His letter told of something strange happening near a remote trading post on the shores of Lake Victoria. Dr. Okware decided to investigate. It was a stressful 4-hour ride. They were heading for Kasensero, a place where traders would meet, and then set off to Tanzania, Kenya, or Rwanda. This place was about as far as you could get from the large metropolitan cities where AIDS had first surfaced.
There was no school there was no roads, there was nothing completely, and there seemed to be no infrastructure for anything, even for keeping law and order. We went into some of the houses to see what had actually happened and also to see the patients.
the clinical symptoms were rather different from anything I had seen before. They were very much wasted. The patients were actually dry. In fact, I remember there was one particular boy whom I saw, and he had been completely drained to the bone because of chronic diarrhea which he had been having for a number of months. There was a lot of agony on his face, and really the situation was quite pathetic. The men too had very aggressive Kaposi sarcoma. But I think at the end of the day, they all had one condition. There was total apathy in their faces, and very, very, very hopeless. We were amazed to find that the only people who were infected in the house were the sexual partners. None of the children were infected, none of the aunties, none of the other relatives in the house were infected.
Dr. Henry Mazzocchi lived near Lake Victoria. He had some medicine obtained from a nurse in Entebbe that provided some temporary relief. That patient, back in 1976, was probably the first case of AIDS in Uganda. Dr. Mazzocchi tried desperately to help him. He had checked the man over thoroughly, tested his blood, and administered medicines and injections to ease his pain. Nothing had worked. Giordano's house still remains empty. His wife died soon afterwards as well. People believed there was something mysterious about the deaths.
At one time, it was believed that some of these people died because of witchcraft, because it was believed that they had cheated their friends during the course of their vices on the lake.
Dr. Okware continued following the killer's trail. Later, he would discover how the deadly disease made its way along the dirt roads until it reached Uganda's main truck route. The route turned out to transport more than just trucks. The places where the truckers spent the night became the breeding grounds for AIDS.
Because the disease is sexually transmitted, obviously when they came with money, they came with goods, they picked up most of the girls in town, and naturally they were the first ones to be infected, and they're also the first ones to infect others. Basically, that's how the disease came to Chitera.
Chitera was the first stop along that fatal trail, the nearest town to the lakeside trading post where Okware's search had begun.
As the goods traveled from Chitera to Masaka, to Kampala, to Jinja, and so on, most of these drivers also carried with them the infection as well as the goods.
Back in Kampala, Dr. Okware was determined to find some answers.
I brought back some samples which were analyzed, and the samples suggested that there was some typhoid and tuberculosis among some of these patients. And most of the patients who should have responded to typhoid treatment and tuberculosis treatment, most of these patients died.
In 1983, the official number of AIDS cases in Uganda was 0. But doctors in Europe were on the brink of proving that statistic completely false. In Paris, Dr. Jacques Leibovitch had already watched 2 African patients die. Their immune systems were shattered.
I immediately and all my colleagues recognized the same disease. So we called each other right on the spot. It was somehow exotic. It obviously had a focus for us, known to us in Africa that the Americans didn't know of.
The National Institutes of Health outside Washington, D.C. was just beginning to research AIDS. In the field of cancer research, Dr. Robert Gallo was quickly becoming a star. At the time, he was head of the prestigious National Cancer Institute. Dr. Gallo had made an important discovery, a human retrovirus. This virus sneaks into the body's genetic code and reproduces itself in what are called the T cells of the immune system. Gallo named the virus the human T-cell leukemia virus, or HTLV,